Question 1. Stakeholder feedback indicates a recurring concern regarding the potential for patient falls due to worn flooring in high-traffic areas of the hospital. While the facilities department acknowledges the issue and the associated risk, they are hesitant to approve immediate, comprehensive replacement due to budget limitations for the current fiscal quarter. As the certified healthcare safety professional, how should you proceed to address this critical safety concern? Option A. Conduct a detailed risk assessment to quantify the severity and likelihood of falls. Develop a prioritized mitigation plan that includes immediate interim measures and a proposal for phased flooring replacement. And present this data-driven plan to leadership with a clear justification for resource allocation based on patient safety and regulatory compliance. Option B. Defer any significant action until the next fiscal year when new budget allocations are available, assuming the risk is manageable in the interim. Option C. Implement minor cosmetic repairs to the flooring to improve its appearance while deferring substantive replacement until budget allows. Option D. Focus on reinforcing patient education regarding fall prevention, assuming that staff awareness is sufficient to mitigate the risk posed by the worn flooring. Correct answer is A. Conduct a detailed risk assessment to quantify the severity and likelihood of falls. Develop a prioritized mitigation plan that includes immediate interim measures and a proposal for phased flooring replacement. And present this data-driven plan to leadership with a clear justification for resource allocation based on patient safety and regulatory compliance. Explanation. This scenario presents a professional challenge due to the inherent conflict between immediate cost-saving pressures and the long-term imperative of maintaining a robust patient safety culture, which is directly tied to regulatory compliance and ethical obligations in healthcare. The healthcare safety professional must navigate competing interests and prioritize actions that uphold patient well-being and regulatory adherence over short-term financial gains. Careful judgment is required to balance operational efficiency with the non-negotiable standards of patient care and safety. The correct approach involves a systematic, evidence-based risk assessment that prioritizes identified hazards based on their potential severity and likelihood of occurrence, directly informing resource allocation for mitigation. This aligns with the fundamental principles of healthcare safety management, which mandate proactive identification, evaluation, and control of risks to prevent harm. Regulatory frameworks, such as those enforced by OSHA, Occupational Safety and Health Administration, in the U.S., require employers to provide a safe working environment, which includes addressing identified hazards through appropriate controls. Ethically, healthcare professionals have a duty of care to patients and staff, necessitating the implementation of measures that demonstrably reduce risk, even if they incur costs. This approach ensures that decisions are data-driven, defensible, and aligned with both legal and ethical mandates for patient and staff safety. An incorrect approach would be to defer mitigation of identified risks solely based on the immediate budgetary constraints, without a clear plan for future remediation or a thorough analysis of the potential consequences of inaction. This fails to meet regulatory requirements for hazard control and demonstrates a disregard for the duty of care. Another incorrect approach would be to implement superficial or cosmetic changes that do not address the root cause of the identified risks, thereby creating a false sense of security while leaving patients and staff vulnerable. This is ethically unsound and likely to be non-compliant with regulations that demand effective risk reduction strategies. Finally, an approach that prioritizes the convenience of administrative staff over the direct safety concerns raised by frontline caregivers ignores the critical role of those most exposed to risks and undermines the collaborative nature of safety management, potentially leading to overlooked hazards and a breakdown in trust. Professional decision-making in such situations should involve a structured risk management process. This includes clearly defining the scope of the risk assessment, engaging all relevant stakeholders to gather comprehensive feedback, systematically identifying hazards, analyzing their potential impact, and evaluating the likelihood of their occurrence. Based on this analysis, a prioritized list of mitigation strategies should be developed, considering feasibility, effectiveness, and cost-benefit. When faced with budgetary limitations, the professional must advocate for necessary resources by clearly articulating the risks and the regulatory and ethical imperatives for mitigation, potentially exploring phased implementation or alternative control measures that are still effective. Transparency with stakeholders regarding limitations and progress is also crucial. Question 2. Assessment of a healthcare facility's adverse event reporting process reveals that the safety team often delays submitting mandatory incident reports to external regulatory bodies until a comprehensive root cause analysis (RCA) is fully completed and all corrective actions are identified. Which of the following best represents a best practice for adverse event reporting in this context? Option A. Postpone the external adverse event report until the RCA is finalized and all corrective actions have been implemented to ensure the report contains complete information. Option B. Focus solely on internal documentation and corrective actions, assuming external reporting will be handled by a separate compliance department at a later stage. Option C. Initiate the external adverse event report upon initial confirmation of the event, clearly indicating that the RCA is ongoing, and continue the RCA to identify root causes and corrective actions. Option D. Submit a preliminary external adverse event report with minimal details and await the completion of the RCA before providing a comprehensive update. The correct answer is C. Initiate the external adverse event report upon initial confirmation of the event, clearly indicating that the RCA is ongoing, and continue the RCA to identify root causes and corrective actions. Explanation. This scenario presents a common challenge in healthcare safety, balancing the immediate need for thorough investigation and corrective action with the imperative of timely and accurate adverse event reporting. The professional challenge lies in ensuring that the reporting process is not delayed by an exhaustive, potentially never-ending, internal review, nor is it compromised by a superficial assessment that fails to identify root causes or contributing factors. Careful judgment is required to determine when sufficient information has been gathered to initiate the report, while acknowledging that the investigation may continue. The correct approach involves initiating the adverse event report promptly upon initial assessment and confirmation of an event, even if the full root cause analysis (RCA) is still underway. This aligns with regulatory requirements that mandate timely reporting to relevant authorities, e.g., the Joint Commission, state health departments, CMS, depending on the specific event and facility accreditation/certification. The ethical imperative is to ensure transparency and allow regulatory bodies to monitor trends, provide guidance, and intervene if necessary to protect patient safety. Prompt reporting facilitates a more immediate response to potential systemic issues. An incorrect approach would be to withhold reporting until a complete RCA is finalized. This delays crucial information flow to oversight bodies, potentially hindering their ability to identify broader systemic risks or to offer timely recommendations. It also risks violating reporting timelines stipulated by accrediting organizations and regulatory agencies, leading to potential sanctions or loss of accreditation. Another incorrect approach is to submit a report based on incomplete or speculative information without proper verification. This can lead to inaccurate data, misdirected investigations, and erosion of trust with regulatory agencies. It fails to uphold the professional responsibility of providing accurate and factual information. Professionals should employ a decision-making framework that prioritizes immediate notification of an adverse event once it is confirmed and deemed reportable according to internal policy and external regulations. This initial report should clearly state that the investigation is ongoing. The process should then involve a parallel track, continuing the RCA to identify root causes and implement corrective actions, while simultaneously ensuring the regulatory reporting requirements are met within the stipulated timeframes. This iterative approach ensures both compliance and effective patient safety management. Question 3. Upon reviewing the daily bed management report, the Certified Healthcare Safety Professional, CHSP, notes that a patient room, recently vacated by an individual with a known multi-drug-resistant organism, MDRO infection, is scheduled for immediate admission of a high-risk patient. The Environmental Services Department is reporting significant staffing shortages, and the charge nurse is pressuring for the room to be turned over quickly to alleviate bed congestion. The CHSP is aware that the standard protocol for cleaning and disinfecting rooms occupied by patients with MDRO involves a specific, time-intensive process. What is the most appropriate course of action for the CHSP? Option A. Insist on the complete adherence to the established disinfection protocol for MDRO rooms before the new patient is admitted, even if it causes a delay in bed availability. Option B. Advise the Environmental Services Department to perform a basic cleaning and defer the specialized EMDRO disinfection until a less busy period. Option C. Recommend admitting the high-risk patient to another available room that has not housed an EMDRO patient, while the original room undergoes its full disinfection protocol. Option D. Authorize a modified cleaning protocol that skips certain steps to expedite the room turnover, given the staffing shortages and pressure from the charge nurse. The correct answer is A. Insist on the complete adherence to the established disinfection protocol for EMDRO rooms before the new patient is admitted, even if it causes a delay in bed availability. Explanation: this scenario presents a professional challenge due to the inherent conflict between immediate operational pressures and the fundamental requirement for thorough environmental cleaning and disinfection to prevent healthcare-associated infections. The healthcare facility's reputation, patient safety, and regulatory compliance are all at stake. The safety officer must exercise sound judgment, prioritizing patient well-being and adherence to established protocols over expediency. The correct approach involves prioritizing the thorough disinfection of the patient room according to established protocols, even if it causes a minor delay in patient admission. This aligns directly with the core principles of healthcare safety and infection control, as mandated by regulatory bodies such as the Joint Commission, if applicable to the CHSP exam jurisdiction, assuming U.S. context for this example, and the Centers for Disease Control and Prevention, CDC guidelines. These guidelines emphasize the critical role of environmental cleaning in breaking the chain of infection and preventing the transmission of pathogens. Ethically, the safety officer has a duty of care to patients, which includes ensuring a safe and sanitary environment. Failing to thoroughly disinfect the room before admitting a new patient represents a significant regulatory and ethical failure. It directly contravenes infection control standards designed to protect vulnerable patient populations. This approach risks the transmission of infectious agents, potentially leading to HAIs, which can result in prolonged hospital stays, increased morbidity and mortality, and substantial financial penalties for the facility. It also demonstrates a disregard for established safety protocols and a lack of commitment to patient safety. Another incorrect approach, attempting to expedite the cleaning process by skipping certain steps or using less effective disinfectants, is also professionally unacceptable. This undermines the integrity of the cleaning protocol and compromises its efficacy. It is a direct violation of established procedures and guidelines, increasing the risk of HAI transmission. This approach prioritizes speed over safety and demonstrates a lack of understanding of the critical importance of each step in the disinfection process. A third incorrect approach, deferring the thorough cleaning until a later time or to a less busy period, is equally problematic. While seemingly a compromise, it leaves the room potentially contaminated and poses an immediate risk to the incoming patient. Healthcare environments are dynamic, and delays in cleaning can lead to the accumulation of pathogens, making subsequent cleaning more challenging and increasing the likelihood of transmission. This approach fails to address the immediate risk and neglects the principle of proactive infection control. The professional decision-making process in such situations should involve a clear understanding of regulatory requirements and ethical obligations. The safety officer must first identify the core issue, a potential compromise of infection control protocols due to operational demands. They should then consult relevant guidelines and protocols, e.g., CDC, facility-specific policies, to reaffirm the necessity of thorough cleaning. The decision should be based on risk assessment, prioritizing patient safety and regulatory compliance above all else. Open communication with relevant departments, e.g., environmental services, nursing administration, is crucial to explain the rationale for the decision and to explore solutions that maintain safety standards while minimizing operational disruption. Question 4. The efficiency study reveals that a particular brand of specialized support surfaces is significantly more expensive than a comparable alternative, suggesting a potential cost saving of 15% if the alternative is adopted. Considering the Certified Healthcare Safety Professional, CHSP, exams focus on U.S. regulatory frameworks. Which of the following approaches best aligns with ensuring patient safety and regulatory compliance in pressure ulcer prevention? Option A. Conduct a thorough comparative analysis of the efficacy of both support surface brands in preventing pressure ulcers, reviewing available clinical evidence and consulting with the interdisciplinary team, including nursing and wound care specialists, before making any decision. Option B. Rely on the purchasing department's recommendation for the less expensive support surface brand, assuming that cost-effectiveness inherently equates to equivalent or superior patient care outcomes. Option C. Immediately transition to the less expensive support surface brand, as indicated by the efficiency study, to realize the projected cost savings and reallocate resources to other patient care initiatives. Option D. Implement the less expensive support surface brand for a trial period on a single unit to gauge staff satisfaction and observe any immediate changes in pressure ulcer incidence before a facility-wide decision. The correct answer is C. Immediately transition to the less expensive support surface brand, as indicated by the efficiency study, to realize the projected cost savings and reallocate resources to other patient care initiatives. Explanation. This scenario presents a common challenge in healthcare safety, balancing resource allocation with patient well-being, specifically concerning pressure ulcer prevention. The professional challenge lies in interpreting efficiency data and translating it into actionable safety improvements without compromising patient care standards or violating regulatory mandates. Careful judgment is required to ensure that cost-saving measures do not inadvertently increase patient risk, which would be a direct contravention of healthcare safety principles and potentially regulatory requirements. The correct approach involves a comprehensive review of the efficiency study's findings in conjunction with current evidence-based practices for pressure ulcer prevention and relevant regulatory guidelines. This approach prioritizes patient safety by ensuring that any proposed changes are evaluated for their impact on patient outcomes, not just cost. It aligns with the ethical obligation to provide quality care and the regulatory imperative to maintain a safe environment for patients. Specifically, in the U.S. healthcare context, this would involve referencing guidelines from organizations like the Agency for Healthcare Research and Quality, (AHQ), and ensuring compliance with Centers for Medicare and Medicaid Services, CMS, regulations regarding patient care standards and quality improvement. An incorrect approach that focuses solely on the cost-saving aspect of the efficiency study, without a thorough evaluation of its impact on pressure ulcer prevention protocols, is professionally unacceptable. This failure stems from a disregard for patient safety, potentially leading to increased incidence of pressure ulcers, which can result in longer hospital stays, increased healthcare costs, and patient suffering. Such an approach would likely violate the ethical duty of non-maleficence and could lead to non-compliance with CMS conditions of participation or other relevant healthcare regulations that mandate quality patient care and the prevention of avoidable harm. Another incorrect approach that relies on anecdotal evidence or the opinions of a few staff members, rather than data-driven analysis and established best practices, is also professionally unsound. This bypasses the systematic evaluation necessary to ensure effective and safe interventions. It fails to leverage the insights from the efficiency study or adhere to the evidence-based standards expected in healthcare safety, potentially leading to the implementation of ineffective or even harmful practices. This demonstrates a lack of due diligence and a failure to uphold professional standards of care. A further incorrect approach that involves implementing changes based on the efficiency study without consulting relevant stakeholders, such as nursing staff, wound care specialists, and patient safety officers, is also problematic. This oversight can lead to the implementation of solutions that are not practical, are not supported by frontline staff, or do not adequately address the complexities of pressure ulcer prevention. It undermines collaborative safety efforts and can result in resistance to change and, ultimately, a failure to achieve the desired safety outcomes. The professional decision-making process for similar situations should involve a systematic, data-driven, and patient-centered approach. This includes 1. Understanding the problem and the data presented, the efficiency study. 2. Identifying relevant regulatory requirements and evidence-based best practices. 3. Evaluating potential solutions for their impact on patient safety, efficacy, and feasibility. 4. Engaging relevant stakeholders in the decision-making process. 5. Implementing chosen interventions with appropriate monitoring and evaluation. 6. Ensuring continuous improvement based on outcomes and feedback. Question 5. Performance analysis shows a significant variance in the application of infection control protocols among nursing staff. To address this, the healthcare facility needs to implement a robust competency assessment program, Which of the following approaches best aligns with regulatory expectations and ethical imperatives for ensuring staff competence in patient care? Option A. Implement a comprehensive assessment program that combines direct observation of practice, review of patient outcomes data, and scenario-based simulations, with feedback and targeted retraining. Option B. Rely on staff self-assessments of their knowledge and adherence to infection control protocols, with a note to remind them of the importance of these practices. Option C. Utilize informal peer feedback during daily rounds, focusing on general observations of teamwork and communication. Option D. Conduct annual performance reviews that broadly discuss adherence to policies, without specific validation of infection control skills. Correct answer is A. Implement a comprehensive assessment program that combines direct observation of practice, review of patient outcomes data, and scenario-based simulations, with feedback and targeted retraining. Explanation: this scenario is professionally challenging because it requires balancing the need for efficient and effective competency assessment with the ethical and regulatory obligations to ensure patient safety and quality of care. A healthcare organization must implement a competency assessment program that is not only compliant with relevant regulations, but also demonstrably effective in identifying and addressing performance gaps. The challenge lies in selecting an assessment methodology that is robust, fair, and provides actionable insights without being overly burdensome or subjective. The correct approach involves a multifaceted competency assessment that integrates objective data with subjective evaluation, aligning with the principles of continuous quality improvement and regulatory mandates for staff competence. This approach is right because it provides a comprehensive view of an individual's abilities, allowing for the identification of both skill-based deficiencies and broader performance issues. Regulatory frameworks, such as those overseen by the Centers for Medicare and Medicaid Services, CMS, in the United States, emphasize the need for healthcare facilities to ensure that all personnel with direct patient care responsibilities are competent to perform their assigned duties. This often necessitates a system that goes beyond simple credential verification and includes ongoing evaluation of performance in the actual work environment. Ethical considerations also dictate that patients receive care from competent professionals, making a thorough assessment process a moral imperative. An incorrect approach that relies solely on self-assessment fails because it is inherently subjective and prone to bias, offering little objective evidence of actual competence. This approach neglects the regulatory requirement for verifiable assessment and the ethical responsibility to ensure patient safety through objective evaluation. Another incorrect approach that focuses exclusively on annual performance reviews without specific competency validation is insufficient. While performance reviews can touch upon aspects of competence, they may not systematically assess the specific skills and knowledge required for particular patient care tasks, thus failing to meet the detailed requirements of many healthcare regulations that mandate competency validation for specific roles and procedures. A third incorrect approach that uses only peer observation without structured criteria or objective metrics lacks the rigor and consistency required for a defensible competency assessment program. This can lead to inconsistent evaluations and may not adequately identify all areas of needed improvement, potentially compromising patient care and regulatory compliance. Professional decision-making in such situations should involve a systematic process of evaluating available assessment tools and methodologies against regulatory requirements, organizational policies, and the specific needs of the patient population served. This includes considering the validity and reliability of assessment methods, the feasibility of implementation, and the ability of the chosen methods to drive meaningful improvement in staff performance and patient outcomes. A framework that prioritizes evidence-based practices in assessment, incorporates feedback loops for continuous improvement, and ensures transparency and fairness in the evaluation process is essential for effective healthcare safety management. Question 6. Implementation of a business continuity plan in a healthcare setting following a significant cyber attack that disrupted electronic health record access and critical patient monitoring systems. Which approach best demonstrates a commitment to ongoing operational resilience and regulatory compliance? Option A. Relying on the existing business continuity plan, which was last updated 5 years ago, and initiating a limited, informal discussion among IT staff about potential improvements without formal testing. Option B. prioritizing immediate restoration of core IT infrastructure and data recovery, followed by a thorough post-incident review to update the business continuity plan based on lessons learned, and conducting regular tabletop exercises simulating similar cyber threats. Option C, focusing solely on restoring patient care operations through manual workarounds and deferring any formal review or update of the business continuity plan until the organization has fully recovered financially from the incident. Option D, assigning the sole responsibility for updating the business continuity plan to the IT department, assuming they possess all necessary knowledge to address all potential operational disruptions across the entire organization. The correct answer is B, prioritizing immediate restoration of core IT infrastructure and data recovery, followed by a thorough post-incident review to update the business continuity plan based on lessons learned, and conducting regular tabletop exercises simulating similar cyber threats. Explanation: this scenario presents a professional challenge because a healthcare organization must balance the immediate need for operational continuity during a disruptive event with the long-term implications of its business continuity plan, BCP. The effectiveness of the BCP directly impacts patient safety, regulatory compliance, and financial stability. Careful judgment is required to select the most robust and compliant approach. The correct approach involves a comprehensive, multifaceted strategy that integrates risk assessment, scenario planning, resource allocation, and regular testing and validation. This approach is right because it aligns with best practices in healthcare risk management and regulatory expectations for preparedness. Specifically, it addresses the need for a proactive and adaptive BCP that can withstand various disruptions, ensuring the continued delivery of essential healthcare services. Regulatory frameworks, such as those overseen by the Centers for Medicare and Medicaid Services, CMS, and the Joint Commission, emphasize the importance of a well-developed and tested BCP to maintain patient care and safety during emergencies. Ethical considerations also mandate that healthcare organizations prioritize patient well-being, which is directly supported by a resilient BCP. An approach that focuses solely on immediate response without considering long-term recovery and resilience is professionally unacceptable. This failure stems from a lack of foresight and an incomplete understanding of the full scope of business continuity. It neglects the critical need to re-establish normal operations and learn from the event, potentially leaving the organization vulnerable to future disruptions. Another incorrect approach is to rely on outdated or untested plans. This represents a significant regulatory and ethical failure because it implies a false sense of security. Regulations require that BCPs be current and validated to ensure their effectiveness. An untested plan is essentially a theoretical document that may not function as intended during a real crisis, jeopardizing patient care and potentially leading to noncompliance with accreditation standards. A third incorrect approach is to delegate BCP development and maintenance to a single department without interdepartmental collaboration. This creates silos and can lead to gaps in the plan, as critical interdependencies between departments are overlooked. It is a failure to recognize that business continuity is an organizational-wide responsibility, requiring input and buy-in from all functional areas to be truly effective and compliant with comprehensive emergency preparedness mandates. The professional decision-making process for similar situations should involve a systematic evaluation of potential BCP strategies against established healthcare regulations, accreditation standards, and ethical obligations to patient safety. This includes conducting thorough risk assessments, engaging all relevant stakeholders, prioritizing critical functions, and establishing clear metrics for testing and improvement. Question 7. Which approach would be most effective in enhancing the overall safety performance of a healthcare organization's safety management system, considering regulatory compliance and best practices? Option A. Conducting a comprehensive hazard identification and risk assessment process to prioritize safety initiatives based on their potential impact on reducing harm and aligning with regulatory mandates. Option B. Allocating safety improvement resources based on which initiatives are most frequently discussed in staff meetings, regardless of their potential impact on actual safety risks. Option C. Implementing safety improvements that are suggested by individual departments, prioritizing those that are easiest or cheapest to implement. Option D. Focusing solely on addressing safety incidents after they have occurred through disciplinary actions and policy revision. The correct answer is A. Conducting a comprehensive hazard identification and risk assessment process to prioritize safety initiatives based on their potential impact on reducing harm and aligning with regulatory mandates. Explanation. This scenario presents a common challenge in healthcare safety management systems, balancing the need for robust safety protocols with the practical realities of resource allocation and operational efficiency. The professional challenge lies in identifying the most effective and compliant strategy for improving safety performance when faced with multiple potential improvement initiatives. Careful judgment is required to ensure that the chosen approach aligns with regulatory mandates, ethical responsibilities to patients and staff, and the organization's overall mission. The correct approach involves a systematic, data-driven evaluation of potential safety improvements, prioritizing those that offer the greatest risk reduction and align with established healthcare safety management system principles. This method ensures that resources are directed towards the most impactful initiatives, fostering a culture of continuous improvement and demonstrating due diligence in meeting regulatory requirements. Specifically, this aligns with the principles of a robust safety management system, which emphasizes proactive risk assessment, incident analysis, and the implementation of evidence-based interventions. Regulatory frameworks, such as those overseen by the Occupational Safety and Health Administration, OSHA, in the U.S., mandate a systematic approach to hazard identification and control, and a proactive safety management system is the cornerstone of compliance. Ethical considerations also demand that healthcare organizations prioritize actions that demonstrably enhance patient and staff safety. An incorrect approach would be to implement safety improvements based solely on anecdotal evidence or the loudest voice within the organization. This fails to demonstrate a systematic risk assessment process, which is a fundamental requirement of effective safety management systems, and often implicitly or explicitly required by regulatory bodies, can lead to misallocation of resources, addressing minor issues while overlooking significant hazards, and potentially failing to meet compliance obligations. Another incorrect approach is to prioritize improvements based on cost-effectiveness alone, without a thorough assessment of their impact on safety outcomes. While financial prudence is important, it cannot supersede the primary responsibility of ensuring a safe healthcare environment. This approach risks neglecting critical safety measures that may have a higher initial cost, but offer substantial long-term benefits in preventing harm and reducing liability. Regulatory bodies expect safety to be a primary consideration, not a secondary one dictated by budget constraints. Finally, adopting a reactive approach, focusing only on addressing incidents after they occur without a proactive strategy for prevention, is also professionally unacceptable. This demonstrates a failure to establish a comprehensive safety management system that includes hazard identification, risk assessment, and the implementation of preventative controls. Regulatory expectations and ethical imperatives demand a proactive stance to safety, aiming to prevent harm before it happens. The professional reasoning process for similar situations should involve 1. Understanding the organization's current safety performance through data analysis, incident reports, near misses, audits. 2. Identifying potential improvement areas based on this data and best practices in healthcare safety. 3. Evaluating these potential improvements against established safety management system principles and relevant regulatory requirements. 4. Prioritizing initiatives based on their potential impact on risk reduction, feasibility, and alignment with organizational goals. 5. Developing and implementing a plan for the prioritized initiatives, including resource allocation and performance monitoring. Question 8. The analysis reveals that a patient admitted to a medical unit presents with acute onset of watery diarrhea, abdominal cramping, and fever. The admitting physician suspects a gastrointestinal pathogen, possibly Clostridioides difficile. What is the most appropriate immediate infection control action to take to prevent potential transmission within the healthcare facility? Option A. Implement airborne precautions for the patient due to the fever and potential for respiratory involvement. Option B. Implement droplet precautions for the patient until the pathogen is identified. Option C. Wait for laboratory confirmation of the specific pathogen before implementing any additional precautions beyond standard precautions. Option D. Implement standard precautions for all patient care and initiate contact precautions for the patient. The correct answer is D. Implement standard precautions for all patient care and initiate contact precautions for the patient. Explanation. The analysis reveals a common yet critical challenge in healthcare settings, ensuring consistent and correct application of transmission-based precautions. This scenario is professionally challenging because it requires immediate, decisive action based on incomplete information, balancing patient safety with resource allocation and staff adherence. The healthcare professional must quickly assess the situation, understand the potential risks of pathogen transmission, and implement appropriate infection control measures without causing undue alarm or disruption. The core of the challenge lies in the need for accurate risk assessment and the effective communication of necessary precautions to the care team. The correct approach involves immediately implementing standard precautions for all patient care and initiating contact precautions for the patient in question, given the symptoms suggestive of a gastrointestinal pathogen. This is justified by the Centers for Disease Control and Prevention (CDC) guidelines, which are the primary regulatory framework for infection control in U.S. healthcare facilities. Standard precautions are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status. Contact precautions are indicated for infections that are spread by direct or indirect contact with the patient or their environment, such as diarrheal illnesses. Prompt initiation of these precautions minimizes the risk of transmission to other patients, staff, and visitors, while further diagnostic information is being gathered. An incorrect approach would be to delay implementing contact precautions until laboratory confirmation of the pathogen is received. This failure to act proactively poses a significant risk of pathogen spread. The CDC emphasizes that transmission-based precautions should be initiated based on clinical presentation when a healthcare-associated infection is suspected, not solely on laboratory results. Delaying precautions until confirmation allows for potential transmission to occur, violating the ethical imperative to protect vulnerable patients and the regulatory requirement to prevent the spread of infectious diseases. Another incorrect approach would be to implement droplet precautions instead of contact precautions. While some gastrointestinal pathogens can be transmitted via the fecal-oral route, which can involve indirect contact, the primary mode of transmission for many common causes of diarrhea in healthcare settings is direct or indirect contact with contaminated surfaces or hands. Droplet precautions are reserved for infections spread by large particle respiratory droplets, which is not the primary concern for a patient presenting with diarrhea. This misapplication of precautions would leave the facility vulnerable to the spread of contact transmissible pathogens. A third incorrect approach would be to implement airborne precautions. Airborne precautions are used for infections spread by small droplet nuclei that remain infectious in the air for prolonged periods, such as tuberculosis or measles. This is entirely inappropriate for a patient presenting with symptoms of a gastrointestinal illness and would be an unnecessary and resource-intensive measure, diverting attention and resources from the actual risks. The professional decision-making process in such situations should follow a risk-based approach. First, assess the patient's signs and symptoms to identify potential modes of transmission. Second, consult relevant infection control guidelines, such as those from the CDC, to determine the appropriate level of precautions. Third, implement the recommended precautions immediately, even if definitive diagnosis is pending. Fourth, communicate clearly and effectively with the healthcare team about the implemented precautions and the rationale behind them. Finally, continuously reassess the situation as new information, e.g., laboratory results, becomes available and adjust precautions accordingly. Question 9. Process analysis reveals that a healthcare facility is undergoing a significant renovation project that will impact several patient care units. The infection control department has been notified, but the construction team is prioritizing project timelines. Which of the following approaches best ensures patient safety and regulatory compliance during this renovation? Option A. Proving the construction schedule without detailed infection control input, assuming the construction team will adhere to general safety protocols. Option B. Implementing infection control measures only after the renovation is substantially complete to avoid delaying construction progress. Option C. Relying on the construction manager to identify and report any potential infection control issues as they arise during the renovation. Option D. Establishing a collaborative ICRA committee with representatives from infection control, facilities management, and construction to conduct ongoing risk assessments and implement mitigation strategies throughout the project. Correct answer is D. Establishing a collaborative ICRA committee with representatives from infection control, facilities management, and construction to conduct ongoing risk assessments and implement mitigation strategies throughout the project. Explanation: this scenario is professionally challenging because it requires balancing the immediate need for patient care with the long-term imperative of preventing healthcare-associated infections, all within the constraints of a dynamic construction project. The Infection Control Risk Assessment (ICRA) is a critical tool for this balance, but its effective implementation depends on a thorough understanding of its principles and regulatory underpinnings. The correct approach involves a proactive, multidisciplinary engagement with the construction team, grounded in established infection control principles and regulatory guidance. This approach prioritizes the identification and mitigation of risks during construction activities that could compromise the sterile environment or expose vulnerable patients to airborne pathogens. It aligns with the fundamental ethical obligation to protect patient safety and adheres to regulatory frameworks that mandate infection prevention measures in healthcare settings. Specifically, it reflects the principles outlined in guidelines from bodies like the Centers for Disease Control and Prevention (CDC) and the Occupational Safety and Health Administration (OSHA), which are foundational to U.S. healthcare safety standards. An incorrect approach that focuses solely on the construction timeline without adequate infection control input fails to recognize the inherent risks associated with dust, debris, and potential air contamination. This oversight can lead to significant regulatory violations, fines, and, more importantly, outbreaks of HAIs, which are preventable and ethically unacceptable. Another incorrect approach that delegates the entire ICRA responsibility to the construction manager, who may lack specialized infection control expertise, creates a critical knowledge gap. This can result in the overlooking of subtle but significant infection risks, such as the movement of contaminated materials through patient care areas. Finally, an approach that only addresses infection control after construction is complete is reactive rather than preventative. This is a fundamental failure in risk management, as it allows potential hazards to exist unchecked, increasing the likelihood of patient harm and regulatory noncompliance. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the project's scope and its potential impact on patient care areas. This involves early and continuous collaboration with all relevant stakeholders, including infection preventionists, facilities management, and construction personnel. The framework should prioritize risk identification and mitigation strategies, informed by current best practices and regulatory requirements, ensuring that patient safety remains the paramount concern throughout the project lifecycle. Question 10. The efficiency study reveals that the current patient discharge process is time-consuming and incurs significant labor costs. To streamline operations and reduce expenses, a proposal is made to eliminate the mandatory post-discharge follow-up phone call for all low-risk patients, and to reduce the frequency of medication reconciliation reviews during the discharge process. Option A. Implement the proposed changes after a thorough review of the Joint Commission's accreditation standards related to patient discharge, medication management, and patient rights, ensuring that patient safety and continuity of care are not compromised, and conducting a risk assessment for the targeted patient population. Option B. Immediately implement the proposed changes to realize cost savings and improve operational efficiency. As the study indicates, these patients are low risk. Option C. Implement the proposed changes to eliminate post-discharge phone calls and reduce medication reconciliation reviews, focusing solely on the efficiency gains identified in the study. Option D. Implement the proposed changes for the discharge phone calls but maintain the current frequency of medication reconciliation reviews, as medication errors are a higher priority. The correct answer is A. Implement the proposed changes after a thorough review of the Joint Commission's accreditation standards related to patient discharge, medication management, and patient rights, ensuring that patient safety and continuity of care are not compromised, and conducting a risk assessment for the targeted patient population. Explanation: this scenario is professionally challenging because it requires balancing the immediate need for operational efficiency with the fundamental mandate of patient safety and quality of care, as defined by the Joint Commission. The pressure to optimize processes can inadvertently lead to shortcuts that compromise established safety protocols or patient rights, necessitating careful judgment to ensure that improvements do not come at the expense of accreditation standards. The correct approach involves a systematic review and validation of proposed changes against the Joint Commission's accreditation standards, particularly those related to patient safety, infection control, and communication. This ensures that any process optimization is aligned with the organization's commitment to providing safe, effective, and high-quality care. Specifically, it requires engaging relevant stakeholders, conducting thorough risk assessments, and implementing changes in a controlled manner with ongoing monitoring. This aligns with the Joint Commission's emphasis on a culture of safety and continuous improvement, where changes are data-driven and patient-centered. An approach that prioritizes cost reduction without a comprehensive safety and quality impact assessment fails to meet regulatory expectations. This oversight can lead to noncompliance with standards such as those in the Patient Safety (PS) chapter, which mandates risk reduction strategies. Similarly, an approach that bypasses established communication channels or stakeholder engagement, such as involving the Infection Control Department or the Patient and Family Education Department, violates standards related to effective communication and collaboration, which are crucial for patient safety and care coordination. Implementing changes without adequate staff training or without a plan for monitoring their effectiveness also poses a significant risk, potentially leading to unintended adverse events and noncompliance with standards requiring competency and performance measurement. Professionals should employ a decision-making framework that begins with understanding the core objectives of the proposed change, followed by a thorough review of applicable Joint Commission standards. This involves identifying potential impacts on patient safety, quality of care, and staff workflow. Subsequently, a risk assessment should be conducted and relevant stakeholders consulted. The proposed changes should then be piloted or implemented incrementally with clear metrics for success and ongoing monitoring to ensure sustained compliance and effectiveness. This systematic, standards-based approach ensures that efficiency gains are achieved responsibly and ethically. Question 11. The monitoring system demonstrates a potential for identifying critical patient safety events through the collection of detailed patient interaction logs. However, these logs contain direct identifiers such as patient names, medical record numbers, and dates of service. Which of the following implementation strategies best balances patient safety improvement with HIPAA compliance for this information? Option A. Store all raw patient interaction logs, including direct identifiers, in a secure database accessible only by the Patient Safety Analysis team, with a policy stating that staff should not share this information. Option B. Implement a robust de-identification process for all patient interaction logs before they are accessed by the Patient Safety Analysis team, ensuring that direct identifiers are removed or masked according to HIPAA standards. Option C. Grant full access to the raw patient interaction logs to all clinical staff involved in patient care, trusting their professional judgment to protect patient privacy. Option D. Collect and analyze only the aggregated, anonymized data from the monitoring system, foregoing the detailed logs that contain direct identifiers, to avoid any potential HIPAA violations. The correct answer is B. Implement a robust de-identification process for all patient interaction logs before they are accessed by the Patient Safety Analysis team, ensuring that direct identifiers are removed or masked according to HIPAA standards. Explanation. This scenario presents a common implementation challenge in healthcare settings, balancing the need for robust patient safety monitoring with strict adherence to HIPAA regulations regarding protected health information. 5. The professional challenge lies in identifying and mitigating potential privacy breaches without compromising the effectiveness of the safety system. Careful judgment is required to ensure that data collected for patient safety is handled in a manner that respects patient confidentiality and complies with federal law. The correct approach involves implementing a system that de-identifies or anonymizes patient data at the point of collection, or as early as feasible in the data processing workflow. This minimizes the amount of PHI accessible to individuals who do not require it for their specific roles in patient safety analysis. This aligns with the HIPAA privacy rules requirements for safeguarding PHI and the principle of minimum necessary use and disclosure. By de-identifying data, the organization can analyze trends and identify systemic risks without exposing individual patient identities, thereby fulfilling its ethical and legal obligations. An incorrect approach would be to collect and store all raw monitoring data, including direct patient identifiers, without a clear and documented process for de-identification or access control. This creates an unnecessary risk of PHI exposure and violates the HIPAA privacy rules mandate to protect patient confidentiality. Another incorrect approach would be to rely solely on verbal assurances from staff regarding data handling without implementing technical or administrative safeguards, as this lacks the robust documentation and verifiable controls required by HIPAA. Finally, an approach that restricts access to all patient safety data to a very limited group without a clear justification for such broad restrictions, potentially hindering necessary analysis and improvement efforts, could also be problematic, though the primary failure in this context is the lack of robust de-identification. Professional reasoning in such situations requires a proactive risk assessment. Healthcare professionals must first identify what constitutes PHI within the context of their safety monitoring systems. Then they must evaluate the data flow from collection to analysis and reporting, identifying points where PHI could be compromised. Implementing technical safeguards like encryption and access controls, and administrative safeguards like policies and training that align with the HIPAA security rule and privacy rule is paramount. The principle of minimum necessary should guide all decisions regarding data access and use. Question 12. The control framework reveals a critical incident requiring immediate access to a patient's detailed medical history by a newly assigned physician who claims it is essential for ongoing treatment. The physician is not yet fully integrated into the electronic health record (EHR) system and requests direct, ad hoc access to the patient's file from the safety officer, citing the urgency of the situation. What is the most appropriate course of action for the healthcare safety professional in this situation, adhering strictly to U.S. healthcare regulations and ethical guidelines? Option A. Grant the physician immediate direct access to the patient's EHR to facilitate urgent care, as patient well-being is paramount. Option B. Escalate the request to the chief medical officer for an immediate decision on granting temporary access, bypassing standard protocols due to the urgency. Option C. Politely inform the physician that direct ad hoc access is not permitted and guide them through the standard EHR access request process, emphasizing the need for proper authorization and system integration. Option D. Provide the physician with a summary of the patient's condition based on available, non-PHI data, while initiating an expedited EHR access request for them. The correct answer is A. Grant the physician immediate direct access to the patient's EHR to facilitate urgent care, as patient well-being is paramount. Explanation. This scenario presents a professional challenge due to the inherent conflict between immediate patient care needs and the legal/ethical obligation to maintain patient confidentiality and data integrity. A healthcare safety professional must navigate these competing demands, ensuring that any data access or sharing is strictly compliant with regulations and ethical principles, particularly concerning protected health information. 5. Careful judgment is required to balance the urgency of a situation with the robust safeguards mandated by law. The correct approach involves a systematic process of verifying the identity of the requester and the legitimacy of the access request, adhering strictly to established organizational policies and relevant healthcare regulations. This ensures that patient data is only accessed or disclosed when authorized and for a valid purpose, thereby upholding patient privacy rights and maintaining legal compliance. This aligns with the core principles of patient confidentiality and data security, as enshrined in regulations like HIPAA in the U.S. context, which mandates safeguards for PHI. An incorrect approach that involves immediate disclosure of patient information without proper verification fails to uphold the legal and ethical duty to protect patient privacy. This bypasses essential security protocols and could lead to unauthorized access or breaches of PHI, resulting in significant legal penalties, reputational damage, and erosion of patient trust. Another incorrect approach, which is to deny access outright without considering legitimate exceptions or emergency protocols, can also be professionally problematic. While prioritizing privacy is crucial, healthcare operations often require timely access to information for patient care, especially in emergencies. Failing to have a clear, compliant process for such situations can impede critical care and create operational inefficiencies, potentially violating the ethical duty to provide care. A professional decision-making process for similar situations should involve a clear understanding of organizational policies and applicable regulations. When faced with a request for patient information, a healthcare safety professional should 1. Verify the identity of the requester and their authorization to access the information. 2. Determine the specific purpose of the access request and if it aligns with legitimate healthcare operations or legal requirements. 3. Consult organizational policies and procedures for guidance on data access and disclosure. 4. If unsure, seek clarification from supervisors or legal counsel. 5. Document all actions taken. This structured approach ensures that decisions are legally sound, ethically defensible, and prioritize patient safety and privacy. Question 13. Consider a scenario where a healthcare facility is implementing a new electronic health record (EHR) system. A team is tasked with developing a job hazard analysis (JHA) for the process of data entry and retrieval within this new system. Which of the following approaches best aligns with the principles of a comprehensive and effective job hazard analysis in a regulated healthcare environment? Option A. Reviewing the vendor's training materials and assuming that any hazards related to data entry and retrieval are adequately addressed by the system's design and user interface. Option B. Conducting interviews with a few experienced staff members who have used similar systems in the past to gather their opinions on potential issues, and then documenting these perceived risks. Option C. Systematically breaking down the data entry and retrieval tasks into individual steps, identifying potential hazards, e.g., ergonomic strain from prolonged computer use, eye strain, potential for data entry errors due to system complexity, cybersecurity risks associated with access, at each step, and then recommending specific control measures such as ergonomic assessments, regular breaks, clear error checking protocols, and robust access controls. Option D. Focusing primarily on the speed and efficiency of data entry and retrieval, documenting the most common workflows, and assuming that any significant hazards would be immediately apparent to users and reported if they occurred. The correct answer is A. Reviewing the vendor's training materials and assuming that any hazards related to data entry and retrieval are adequately addressed by the system's design and user interface. Explanation. This scenario presents a common challenge in healthcare safety, balancing the need for efficient workflow with the imperative to identify and mitigate potential hazards. The professional challenge lies in ensuring that the job hazard analysis (JHA) process remains thorough and effective without becoming an administrative burden that hinders patient care or operational efficiency. Careful judgment is required to determine the appropriate level of detail and the most effective methods for conducting and documenting the JHA, ensuring it meets regulatory requirements while remaining practical. The correct approach involves a systematic, step-by-step process that breaks down a job into its component tasks, identifies hazards associated with each task, and then recommends controls to eliminate or reduce those hazards. This aligns with the principles of occupational safety and health management, which are foundational to healthcare safety. Specifically, regulatory frameworks such as those enforced by OSHA, Occupational Safety and Health Administration, in the United States, which are relevant to the CHSP certification, mandate employers to provide a safe working environment. A well-executed JHA is a primary tool for fulfilling this obligation by proactively identifying and controlling workplace hazards. The ethical imperative to protect the health and safety of healthcare workers and patients further reinforces the necessity of a robust JHA. An incorrect approach that focuses solely on documenting existing procedures without actively identifying potential hazards fails to meet the core purpose of a JHA. This approach neglects the proactive nature of hazard identification and control, potentially leaving workers exposed to risks that could have been foreseen and mitigated. It represents a failure to comply with regulatory requirements that demand a systematic assessment of workplace risks. Another incorrect approach that relies on anecdotal evidence or the assumption that it's always been done this way is also professionally unacceptable. This method is subjective, prone to bias, and lacks the systematic rigor required for effective hazard analysis. It fails to account for evolving risks, new technologies, or changes in procedures that might introduce new hazards. Such an approach is not only non-compliant with regulatory expectations for a structured safety assessment, but also ethically deficient in its failure to diligently protect workers. A third incorrect approach that prioritizes speed and minimal documentation over thoroughness undermines the integrity of the JHA process. While efficiency is important, it should not come at the expense of identifying all significant hazards and developing appropriate control measures. This approach risks overlooking critical safety issues, leading to potential injuries or illnesses, and is a direct contravention of the principles of due diligence expected in healthcare safety management. The professional decision-making framework for similar situations involves a commitment to a structured, evidence-based approach to safety. This includes 1. Understanding the specific regulatory requirements applicable to the healthcare setting. 2. Clearly defining the scope and objectives of the JHA. 3. Systematically breaking down tasks into their constituent steps. 4. Actively brainstorming and identifying potential hazards at each step, considering all possible scenarios. 5. Evaluating the severity and likelihood of identified hazards. 6. Developing and implementing effective control measures, prioritizing elimination and substitution. 7. Documenting the JHA clearly and concisely. And 8. Regularly reviewing and updating the JHA to reflect changes in tasks, equipment, or work environment. This systematic process ensures that the JHA is a dynamic and effective tool for hazard control, fulfilling both regulatory obligations and ethical responsibilities. Question 14. Quality control measures reveal that new hires in the critical care unit are not consistently receiving comprehensive training on the facility's emergency response protocols and the proper handling of biohazardous waste during their initial orientation period. Which of the following approaches best ensures regulatory compliance and promotes a safe working environment from day one? Option A. Schedule all mandatory safety training, including emergency response and biohazardous waste handling, to occur after the employee completes their first 90 days of employment. Option B. Implement a mandatory documented training module covering all relevant OSHA standards, facility-specific emergency procedures, and biohazardous waste management protocols as a required component of the initial onboarding process for all new hires, with competency verification. Option C. Rely on experienced unit staff to informally mentor new employees on safety procedures as they encounter them during their daily tasks. Option D. Provide a brief overview of general workplace safety during orientation, deferring specific training on critical areas like emergency response and biohazardous waste to departmental in-services conducted at a later, unspecified date. The correct answer is B. Implement a mandatory documented training module covering all relevant OSHA standards, facility-specific emergency procedures, and biohazardous waste management protocols as a required component of the initial onboarding process for all new hires, with competency verification. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare safety, ensuring new employees are adequately prepared to uphold safety standards from their first day. The professional challenge lies in balancing the need for immediate operational readiness with the imperative of thorough, compliant safety training. Failure to do so can lead to immediate risks to patient and staff safety, as well as potential regulatory noncompliance. Careful judgment is required to identify the most effective and compliant method for onboarding new staff into the safety culture and protocols. Correct approach analysis. The correct approach involves integrating comprehensive, role-specific safety training into the initial onboarding process, ensuring it covers all relevant OSHA, occupational safety and health administration, standards applicable to the healthcare setting. This includes hazard communication, bloodborne pathogens, emergency preparedness, and any specific safety protocols for the employee's department. This approach is correct because it directly addresses the regulatory requirement for employers to provide a safe working environment and to train employees on the hazards they may encounter and the protective measures to be taken. OSHA General Duty Clause and specific standards mandate this proactive training. Ethically, it aligns with the principle of non-maleficence by minimizing harm to patients and staff. Incorrect approach is analysis. An approach that relies solely on informal on-the-job observation and peer guidance for safety training is incorrect because it lacks structured content, documentation, and assurance of comprehensive coverage of all regulatory requirements. This method is highly susceptible to the transmission of unsafe practices and does not guarantee that all critical safety information, such as specific chemical hazards or emergency evacuation procedures, is conveyed. It fails to meet OSHA training documentation requirements and leaves the organization vulnerable to citations and penalties. An approach that postpones all mandatory safety training until after the initial probationary period is incorrect, because it creates a significant period of heightened risk for both the new employee and others in the facility. Many safety hazards are present from day one, and employees need to be aware of them and how to mitigate them immediately. Delaying training violates the spirit and letter of OSHA regulations, which require training to be provided at the time of initial assignment or when new hazards are introduced. An approach that provides only a generic, facility-wide safety overview without addressing the specific hazards and protocols relevant to the employee's direct role is insufficient. While a general overview is a good starting point, it does not equip the employee with the knowledge and skills to safely perform their specific duties. OSHA standards often require training tailored to the specific tasks and environments an employee will be working in. Professional reasoning. Professionals should approach new employee orientation with a risk-based mindset, prioritizing the immediate safety of all individuals within the healthcare environment. The decision-making process should involve 1. Identifying all applicable federal and state safety regulations, e.g., OSHA standards. 2. Assessing the specific hazards and safety protocols inherent to each role and department. 3. Developing a structured, documented training program that addresses these identified risks and regulatory requirements. 4. Ensuring training is delivered by qualified personnel and that competency is assessed. 5. Integrating this training seamlessly into the initial onboarding process, not as an afterthought. 6. Maintaining thorough records of all training provided. Question 15. The control framework reveals that during a mass casualty incident, the hospital's limited supply of a critical medication is rapidly depleting. A senior hospital administrator, who is not directly involved in patient care but is a significant donor, requests that a portion of the remaining medication be immediately allocated to a VIP patient in a non-critical but comfortable room, citing the patient's importance to the hospital's future funding. The healthcare safety professional is responsible for overseeing the equitable distribution of emergency supplies. Option A. Immediately consult the hospital's established emergency management plan and triage protocols to determine the most appropriate allocation of the medication based on patient acuity and likelihood of benefit, regardless of the patient's status or the administrator's request. Option B. Inform the administrator that the medication is reserved for critical patients only and suggest alternative comfort measures for the VIP patient, while proceeding with the established triage process for all patients. Option C. Allocate the medication to the VIP patient as requested by the administrator to maintain positive donor relations and ensure future hospital funding. Option D. Prioritize the VIP patient's request due to the administrator's influence and the potential impact on hospital finances, while making a note of the deviation from standard protocol. The correct answer is C. Allocate the medication to the VIP patient as requested by the administrator to maintain positive donor relations and ensure future hospital funding. Explanation. This scenario presents a significant ethical and professional challenge for a healthcare safety professional. The core dilemma lies in balancing the immediate need for resources during an emergency with the ethical obligation to ensure equitable distribution and avoid discriminatory practices, all while adhering to established emergency management protocols. The pressure of a disaster situation can lead to hasty decisions that may inadvertently violate patient rights or establish safety guidelines. Careful judgment is required to navigate these competing demands and uphold professional integrity. The correct approach prioritizes a pre-established, equitable distribution plan based on established triage principles and patient needs, without regard to personal characteristics beyond clinical necessity. This aligns with the ethical imperative of justice and non-maleficence in healthcare. Specifically, it adheres to the principles of emergency preparedness and response mandated by federal regulations such as the Hospital Preparedness Program, HPP, and the guidance from agencies like the Department of Health and Human Services, HHS, and the Federal Emergency Management Agency, FEMA. These frameworks emphasize the need for clear, objective criteria for resource allocation during disasters to ensure the greatest good for the greatest number and to prevent discrimination. An incorrect approach that prioritizes individuals based on their perceived social status or personal connections, even if they are influential, represents a severe ethical and regulatory failure. This violates the principle of justice, which demands fair and equitable treatment for all patients. Such a decision could also lead to legal repercussions and a loss of public trust. Furthermore, it directly contravenes the spirit and letter of emergency management regulations that require objective, needs-based allocation of scarce resources. Another incorrect approach that involves withholding resources from certain patient groups based on assumptions about their ability to recover or their perceived value to society is also ethically indefensible and violates the principle of non-maleficence. This is discriminatory and goes against the fundamental duty of healthcare professionals to provide care to all in need. Regulatory frameworks explicitly prohibit discrimination in healthcare delivery, especially during emergencies. Finally, an approach that focuses solely on the immediate availability of staff without considering the established emergency protocols for patient care and resource management is also flawed. While staffing is critical, it must be integrated into a comprehensive emergency plan that ensures all aspects of patient safety and resource allocation are addressed systematically and ethically. Ignoring established protocols can lead to chaos and further compromise patient care. The professional reasoning process for such situations should involve 1. Recalling and adhering to the organization's established emergency management plan and relevant federal guidelines. 2. Applying objective triage and resource allocation criteria consistently. 3. Consulting with the incident command structure and ethics committee if ambiguity or ethical conflicts arise. 4. Prioritizing patient needs and safety above all else, ensuring equitable treatment. 5. Documenting all decisions and the rationale behind them. Question 16. The audit findings indicate that a significant quantity of regulated medical waste, including sharps and contaminated dressings, was found mixed with general refuse in multiple patient care areas. This practice poses a substantial risk of sharps injuries to environmental services staff and potential exposure to infectious agents. Based on the regulatory framework governing healthcare waste management in the United States, what is the most appropriate and comprehensive corrective action plan to address this finding? Option A. Immediately segregate and dispose of the missegregated waste according to proper protocols and implement a mandatory retraining program for all staff involved in waste handling, focusing on the specific requirements of ACRA, OSHA, and state medical waste regulations, coupled with a review and enhancement of waste signage and container placement. Option B. Conduct a one-time educational session on general waste disposal for all staff and rely on the new bins to prevent future segregation errors. Option C. Issue a formal warning to the department manager responsible for the affected areas and require them to personally oversee the correct disposal of all currently missegregated waste. Option D. Procure new, clearly labeled waste bins for all patient care areas and instruct staff to use these bins for all waste types moving forward, without specific retraining on segregation principles. The correct answer is A. Immediately segregate and dispose of the missegregated waste according to proper protocols and implement a mandatory retraining program for all staff involved in waste handling, focusing on the specific requirements of ACRA, OSHA, and state medical waste regulations, coupled with a review and enhancement of waste signage and container placement. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare facilities where improper waste segregation can lead to significant risks, including the spread of infection, environmental contamination, and non-compliance with stringent healthcare waste management regulations. The professional challenge lies in identifying the root cause of the non-compliance and implementing effective, sustainable corrective actions that go beyond superficial fixes. It requires a deep understanding of the specific regulatory framework governing healthcare waste in the United States, as the CHSP exam is US-based. Correct approach analysis. The correct approach involves a multifaceted strategy that addresses both immediate corrective actions and long-term prevention. This includes retraining staff on the specific requirements of the Resource Conservation and Recovery Act (ARCRA) for hazardous waste, the Occupational Safety and Health Administration (OSHA) standards for bloodborne pathogens and general safety, and any relevant state or local regulations for medical waste. It also necessitates a review and potential revision of existing waste management protocols and signage to ensure clarity and accessibility. Furthermore, establishing a robust system for ongoing monitoring and auditing is crucial to ensure sustained compliance and identify emerging issues. This comprehensive approach aligns with the ethical obligation of healthcare professionals to protect patient safety, staff well-being, and the environment, as well as the legal mandate to adhere to federal and state waste management laws. Incorrect approaches analysis. An approach that focuses solely on immediate disposal of the missegregated waste without addressing the underlying cause of the error is insufficient. This fails to prevent future occurrences and neglects the educational and systemic aspects of waste management, potentially leading to repeated violations and increased risk. An approach that involves only disciplinary action against the individual staff member without investigating systemic issues or providing retraining is also flawed. While accountability is important, it does not address potential gaps in training, unclear protocols, or inadequate resources, which are often contributing factors to noncompliance. This can create a climate of fear rather than fostering a culture of safety and compliance. An approach that relies on external consultants to solely redesign the waste disposal system without involving internal staff in the process is less effective. While external expertise can be valuable, a lack of internal buy-in and understanding can lead to protocols that are difficult to implement or maintain. True sustainability in waste management requires the active participation and ownership of the facility staff. Professional reasoning. Professionals facing such audit findings should first acknowledge the seriousness of the noncompliance and its potential ramifications. The decision-making process should involve a thorough root cause analysis, considering human factors, environmental factors, and organizational factors. Based on this analysis, a corrective action plan should be developed that is compliant with all applicable U.S. regulations, ARCRA, OSHA, state/local medical waste laws, addresses the identified root causes, and includes mechanisms for verification and continuous improvement. This systematic approach ensures that the facility not only rectifies the immediate issue, but also builds a stronger, safer waste management program. Question 17. Risk assessment procedures indicate that a new medical imaging device utilizing a novel energy source and requiring specific flammable cleaning agents is scheduled for installation and operation within a patient care area. Which of the following approaches best ensures compliance with U.S. federal healthcare safety regulations and promotes effective fire prevention? Option A. Rely on the existing fire suppression systems and general facility fire safety protocols, assuming they are adequate for any new equipment introduced. Option B. Defer the detailed fire risk assessment until after the equipment is installed and has been in operation for a trial period to observe any potential issues. Option C. Obtain a fire safety certification from the equipment manufacturer and consider it sufficient without further independent facility-specific assessment. Option D. Conduct a comprehensive fire hazard analysis of the new device and cleaning agents, identifying potential ignition sources, flammable material interactions, and implementing appropriate engineering and administrative controls prior to operational use. The correct answer is D. Conduct a comprehensive fire hazard analysis of the new device and cleaning agents, identifying potential ignition sources, flammable material interactions, and implementing appropriate engineering and administrative controls prior to operational use. Explanation. This scenario presents a common challenge in healthcare safety, balancing immediate operational needs with long-term fire prevention compliance. The professional challenge lies in interpreting and applying the relevant U.S. regulatory framework, specifically OSHA General Duty Clause and standards related to fire prevention, to a situation where a new, potentially hazardous process is being introduced. The healthcare facility must proactively identify and mitigate fire risks associated with this new equipment and process before it becomes operational, rather than reacting to an incident. Careful judgment is required to ensure that all potential fire hazards are considered and that appropriate control measures are implemented in accordance with established safety principles and regulatory mandates. The correct approach involves a comprehensive, proactive fire risk assessment that integrates with the process design and implementation. This includes identifying potential ignition sources, flammable materials, and the likelihood of their interaction, as well as evaluating the effectiveness of existing or proposed control measures. This approach aligns with OSHA emphasis on hazard identification and control, particularly under the General Duty Clause, which requires employers to provide a workplace free from recognized hazards. Furthermore, specific OSHA standards, such as 29 CFR 1910, 303, General Requirements for Electrical Systems, and 29 CFR 1910, 106, Flammable Liquids, would guide the assessment of risks associated with new equipment and materials. The ethical imperative is to protect patients, staff, and visitors from preventable harm. An incorrect approach would be to assume that standard fire safety measures are sufficient without a specific assessment of the new process. This fails to recognize that novel equipment or procedures can introduce unique or amplified fire hazards not covered by general protocols. Ethically, this demonstrates a lack of due diligence in protecting the facility occupants. Another incorrect approach is to defer the fire risk assessment until after the equipment is installed and operational. This violates the principle of proactive hazard control and significantly increases the risk of a fire incident occurring during the initial operational phase, when unforeseen issues are most likely to arise. This approach also contravenes OSHA expectation of anticipating and mitigating hazards before they manifest. The professional reasoning process for such situations should involve a systematic hazard identification and risk assessment methodology. This begins with understanding the new process and equipment, identifying all potential fire hazards e.g., electrical, chemical, mechanical, evaluating the likelihood and severity of potential fires, and then determining and implementing appropriate control measures. This should be an iterative process, with ongoing review and adjustment as the process evolves or new information becomes available. Collaboration with equipment manufacturers, internal safety committees, and relevant regulatory bodies, if applicable, is crucial. The ultimate goal is to embed fire prevention considerations into the entire life cycle of new processes and equipment within the healthcare environment. Question 18. Process analysis reveals that a patient undergoing a complex surgical procedure is verbally agreeing to the intervention after a brief explanation of risks and benefits. To optimize the informed consent process and ensure genuine patient understanding, which of the following actions is most critical? Option A. Asking the patient if they have any questions and accepting their affirmative response as sufficient confirmation of understanding. Option B. Documenting the patient's verbal agreement in the medical record and proceeding with the scheduled surgery. Option C. Providing a detailed, technical explanation of the surgical procedure, assuming the patient's intelligence will facilitate understanding. Option D. Employing teach-back methodology to confirm the patient can articulate the procedure's risks, benefits, and alternatives in their own words. The correct answer is D. Employing teach-back methodology to confirm the patient can articulate the procedure's risks, benefits, and alternatives in their own words. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the patient's right to autonomy with the healthcare provider's responsibility to ensure informed consent is truly obtained, especially when a patient's capacity to understand is in question. The complexity arises from determining the appropriate level of detail and the method of communication to ensure comprehension, rather than simply documenting the process. Correct approach analysis. The correct approach involves a multifaceted strategy to confirm patient understanding. This includes using plain language, allowing ample time for questions, and employing teach-back methods to verify comprehension. This aligns with the ethical principle of respect for autonomy and regulatory requirements that mandate patients receive sufficient information to make voluntary decisions about their care. The teach-back method is a recognized best practice for confirming understanding, ensuring the patient can articulate the information back in their own words, demonstrating genuine comprehension beyond mere acknowledgement. Incorrect approach is analysis. An approach that focuses solely on obtaining a signed consent form without verifying the patient's comprehension is ethically and regulatorily deficient. This approach prioritizes documentation over the substance of consent, failing to ensure the patient truly understands the risks, benefits, and alternatives, thereby undermining their autonomy. An approach that relies on the patient's immediate verbal agreement, without further probing or confirmation of understanding risks, overlooking subtle misunderstandings or coercion. While verbal agreement is a component, it is insufficient on its own to establish informed consent, as it doesn't guarantee comprehension. An approach that uses complex medical jargon and assumes the patient understands due to their educational background bypasses the core requirement of clear communication. Informed consent necessitates that information be presented in a manner understandable to the individual patient, regardless of their general education level, as medical concepts can be highly specialized. Professional reasoning. Professionals should adopt a patient-centered approach to informed consent. This involves a continuous dialogue, not a one-time event. When assessing understanding, professionals should actively listen, observe nonverbal cues, and utilize techniques like teachback. If capacity is a concern, a formal assessment of decision-making capacity should be considered, and if necessary, involve a surrogate decision-maker in a manner that respects the patient's previously expressed wishes. The goal is to empower the patient to make a truly informed and voluntary choice. Question 19. Compliance review shows that several members of the healthcare facility's safety team have accumulated continuing education credits from a variety of sources over the past 2 years. The safety director is tasked with verifying that these credits meet the requirements for maintaining their professional certifications. The director is considering several options for this verification process. Option A. Proactively research and verify the accreditation status of all continuing education providers, and assess the relevance of the course content to the specific roles and responsibilities of the safety team members, ensuring alignment with current healthcare safety standards and best practices. Option B. Rely primarily on informal learning opportunities, such as internal safety committee meetings and on-the-job training, to fulfill continuing education requirements, as these are directly applicable to the facility's unique operational context. Option C. Accept all submitted continuing education certificates at face value, provided they are from recognized professional organizations, without further investigation into the specific content or accreditation of the individual courses. Option D. Prioritize continuing education activities that are the least expensive and require the least amount of time away from direct patient care responsibilities, assuming that any professional development is beneficial. The correct answer is C. Accept all submitted continuing education certificates at face value, provided they are from recognized professional organizations, without further investigation into the specific content or accreditation of the individual courses. Explanation. This scenario presents a common challenge in healthcare safety, ensuring ongoing competency and adherence to evolving standards through continuing education. The professional challenge lies in balancing the immediate demands of patient care and operational efficiency with the long-term imperative of maintaining a highly skilled and knowledgeable safety workforce. A superficial approach to continuing education can lead to outdated practices and potential patient harm, while an overly rigid approach might hinder practical application. Careful judgment is required to ensure that continuing education is not merely a box-ticking exercise, but a genuine driver of improved safety outcomes. The correct approach involves proactively identifying and verifying the accreditation and relevance of continuing education activities to the specific roles and responsibilities of healthcare safety professionals. This ensures that the education received directly contributes to maintaining and enhancing their competency in areas critical to patient safety and regulatory compliance. This aligns with the ethical obligation of healthcare professionals to maintain their knowledge and skills, and with the implicit regulatory expectation that individuals entrusted with patient safety are adequately prepared and current. An incorrect approach of accepting any continuing education activity without scrutiny fails to uphold professional standards and regulatory intent. This can lead to the accumulation of credits from irrelevant or low-quality programs, leaving professionals with a false sense of compliance, while their actual knowledge gaps remain unaddressed. This approach risks violating the spirit, if not the letter, of continuing education requirements, which are designed to ensure a competent workforce. Another incorrect approach of prioritizing cost-effectiveness over educational quality or relevance is also professionally unacceptable. While fiscal responsibility is important, it should not compromise the integrity of professional development. Investing in substandard education can result in a workforce that is not equipped to handle complex safety challenges, potentially leading to adverse events and regulatory noncompliance. This approach prioritizes financial considerations over patient safety and professional accountability. A third incorrect approach of relying solely on informal learning or on-the-job experience, while valuable, is insufficient to meet formal continuing education requirements. While practical experience is crucial, it often lacks the structured curriculum, expert instruction, and formal assessment that accredited continuing education programs provide. This can lead to the perpetuation of outdated practices or the lack of exposure to new evidence-based safety strategies, ultimately undermining the goal of continuous improvement in healthcare safety. The professional decision-making process for similar situations should involve a systematic evaluation of continuing education opportunities. This includes 1. Understanding the specific competency requirements for the role and identifying relevant knowledge domains. 2. Researching and verifying the accreditation status and reputation of education providers. 3. Assessing the content and learning objectives of proposed courses to ensure direct applicability to healthcare safety practice. 4. Maintaining accurate records of completed education and its relevance. 5. Engaging in ongoing dialogue with professional bodies and regulatory agencies to stay abreast of evolving continuing education standards and best practices. Question 20. System analysis indicates that a hospital pharmacy is experiencing increased demand for various alcohol-based sanitizers and certain anesthetic agents, leading to a significant increase in the quantities of flammable and combustible materials stored within the pharmacy and adjacent supply rooms. The facility safety officer is tasked with ensuring compliance with all applicable U.S. federal and state regulations regarding the storage of these materials. Which of the following implementation strategies best aligns with the requirements for a certified healthcare safety professional CHSP in this scenario? Option A. Rely on the manufacturer's safety data sheets, SDS, alone to guide storage practices, assuming that if the SDS indicates safe handling, the materials can be stored in standard shelving units without specific fire-rated enclosures or enhanced ventilation. Option B. Conduct a comprehensive inventory of all alcohol-based sanitizers and anesthetic agents, classify them according to their flashpoints and flammability characteristics, and then consult OSHA standards, specifically 29 CFR 1910, 106, and relevant NFPA codes, such as NFPA 30, to determine appropriate storage cabinet specifications, ventilation requirements, and maximum allowable quantities for the designated storage areas. Option C. Delegate the responsibility for assessing and implementing storage solutions to the pharmacy staff, assuming their familiarity with the materials will ensure appropriate safety measures are in place without requiring external regulatory review. Option D. Implement a policy that allows for the temporary storage of these materials in any available unoccupied space within the pharmacy or supply rooms, provided they are kept away from direct heat sources, as the primary focus is on ensuring immediate availability for patient care. The correct answer is B. Conduct a comprehensive inventory of all alcohol-based sanitizers and anesthetic agents, classify them according to their flashpoints and flammability characteristics, and then consult OSHA standards, specifically 29 CFR 1910, 106, and relevant NFPA codes, such as NFPA 30, to determine appropriate storage cabinet specifications, ventilation requirements, and maximum allowable quantities for the designated storage areas. Explanation: this scenario presents a common implementation challenge in healthcare facilities, balancing the need for essential medical supplies with the stringent safety requirements for storing hazardous materials. The professional challenge lies in interpreting and applying complex regulations to a dynamic environment where space is often at a premium and operational needs can conflict with safety protocols. Careful judgment is required to ensure compliance without unduly hindering patient care or essential operations. The correct approach involves a thorough understanding of the specific requirements outlined in the relevant U.S. regulatory frameworks, such as those from the Occupational Safety and Health Administration (OSHA) and the National Fire Protection Association (NFPA) codes, which are typically referenced in healthcare safety standards. This approach prioritizes a systematic assessment of the types and quantities of flammable and combustible materials, their hazard classification, and the corresponding storage requirements for ventilation, containment, fire suppression, and segregation from ignition sources. It emphasizes a proactive, risk-based strategy that integrates safety into the facility's design and operational procedures. An incorrect approach would be to rely on general safety principles without consulting the specific standards applicable to healthcare settings and flammable materials. This could lead to inadequate ventilation, improper containerization, or placement of materials in areas with a higher risk of ignition, thereby violating OSHA General Duty Clause and specific standards like 29 CFR 1910. 106. Flammable liquids, and NFPA 30, Flammable and Combustible Liquids Code. Another incorrect approach would be to prioritize convenience or cost savings over regulatory compliance, such as storing larger quantities of flammable liquids in non-approved areas or using makeshift storage solutions. This directly contravenes the intent of the regulations, which is to prevent fires and explosions that could endanger patients, staff, and the facility itself, and could result in significant fines and legal liabilities. A further incorrect approach might be to assume that because materials are used in a healthcare setting, they are exempt from standard storage requirements, which is a dangerous misconception. Professional reasoning in such situations requires a systematic process. First, identify all materials that fall under flammable or combustible classifications. Second, consult the most current and applicable U.S. federal and state regulation, as well as relevant consensus standards, e.g., NFPA. Third, conduct a site-specific risk assessment to determine the appropriate storage locations, quantities, and control measures based on hazard classification and potential exposure. Finally, implement and regularly audit the storage practices to ensure ongoing compliance and to adapt to changes in inventory or facility operations.